I don't want to rule or conquer anyone. I should like to help everyone if possible. Jew, Gentile, black man, white. We all want to help one another. Human beings are like that.
You ready?
Yep.
And on that note, hello and welcome to another episode of the At Random podcast. I'm your host Alex, and joining me today solely is Ali. How are you doing?
I'm okay. I'm sitting very close to you, which we don't usually do that. We have a barrier between us, so staring straight at your face is odd.
Yeah, I know, it's breathtaking, isn't it? So that's why you feel a bit weird. But yeah, so Andy, he's not joining us today. Unfortunately, our first one without him, without our spiritual leader. His whole family's like dying of a stomach bug or something, so he's on dad duties.
Yeah, he has another poop story to tell us next week, probably.
Yep, so yeah, this one, we're trying something new, so we hope the audio is not terrible. We're just trying to do a one mic setup between us, whereas obviously usually we do two when we have Andy on, but we want to make this one easy to edit. Fingers crossed, probably won't be. So if it sounds like shit, blame Andy.
Everything is Andy's fault.
Yeah, pretty much. Right, this we don't know how long this one will go for, but we'll do our best. So this one, I wanted to do something fun, but still sort of interesting. I think Andy probably would enjoy this more than you, but...
As always, like everything else.
Yeah, but I honestly don't give a fuck, to be honest. So we're going to do today, what I want to talk about is medicine in warfare, more specifically medical advancements from war. Mm-hmm. Stopping at World War One. I didn't bother looking.
So everything before World War One.
Yeah, because I figured like most people, you know, we know a lot about what the Nazis did and what, you know, experimenting with things like rejection drugs and stuff like that. So I figured let's keep it more on maybe some more interesting stuff. There's some stuff in here I completely just did not know.
Cool.
Yeah,
let's do it.
And I'm going to have a couple of questions for you, like, you know, what year do you think, have a guess, just for a bit of fun. Mix it up, since it's obviously just the two of us. So let's get into it, shall we?
Yep.
So we are focusing on battlefield medicine, or also known as like field surgery or combat casualty care. It's responsible for a lot of major advancements in modern civilian medicine, so not just... So the focus on this is stuff that now we, in our regular lives, use, that was pioneered or maybe not first started in warfare, but advanced greatly because of warfare.
So they just build the building blocks to sort of...
Yeah, or, you know, they took it from a primitive state to a more advanced state that now we have the quality of healthcare that we do in many Western countries around the world. Mm-hmm. So without further ado, so you know what a tourniquet is, right?
I think so. It's more, I probably know what it is, but it's the words in English.
Yeah. Well,
is that the beds?
No.
No.
I have the explanation, don't worry.
Okay.
So a tourniquet is a device to apply pressure.
Okay, yeah. Now I know what it is, yes.
Yeah, so it's a device to apply pressure to a limb or like an extremity.
Yeah.
To like limit the flow of blood. Not to stop it, but to limit, to restrict, so... You know, to stop blood loss, but obviously you still want some blood flowing so you don't get gangrene and blood poisoning and stuff like that.
Yeah, you don't want the limb dying off.
Exactly. It can be made from things as simple as like a leather belt through to a stick with, you know, stick and rope, really simple things. And obviously these days we have, you know, super hyper advanced, like pressurized, almost like vacuum seals that they now put on. But yeah, I mean, you can make a tourniquet out of anything. Human beings have been using it for a very long time. But specifically, I have a question for you, straight off the bat. Question 1. Tourniquets were first noted to have been used during Alexander the Great's military campaigns in the 4th century before Christ.
Yeah.
True or false? So 2,500 years ago, basically.
I would say yes.
True? You would be correct. They were first documented as being used by a military 2,500 years ago.
Yeah. I don't know. In a sense, it sounds like simple medicine. Like it sounds weird to say it like that, but
yeah,
you would want, like, let's say if you have a broken leg, like
Yeah.
a femur or something like that. Like obviously you have blood flowing there to try to repair it because that's what the body does.
Yeah.
So obviously to limit the blood flow, you would put pressure on it. So I think people would try to figure that out quite quickly, like throughout history.
Yeah, like I said, we've had them for a long time, but from
first-
being used in the military, that's sort of how we got these like vacuum sealed ones and stuff that we have now. Because obviously the thing ultimately that governments care about, who fund your medical system, are having more soldiers available for the meat grinder. They were also commonly used by the Romans around that time to control bleeding, especially after amputations.
Yeah.
Which is a common thread on many of these advancements, to be honest. Quite gory. But I guess you can imagine, having your arm cut off.
Well, warfare back in the day was quite...
Yeah, well, a sword
the damage.
slicing you.
Yeah, the damage was different compared to now that everything is just drones and shit. Like people actually fought face to face and did major damage to each other.
Yes, exactly. But these early military tourniquets were actually made of two narrow strips of bronze with only a strip of leather to like go over your skin to comfort you. They were mostly made of metal, so they were not very comfortable at all. They were very primitive. So there's just going to be some quick ones on here, and then at the end I have a much more interesting, I think anyway, like sort of story actually. Okay, so the next one, something we all, I think, in modern society, no matter what country, ambulances. Right? Of course, they're a vehicle dedicated to carrying injured persons, and something we take for granted and have been commonplace for centuries, right? In most societies. I think we've all seen an ambulance.
Have you ever ridden an ambulance?
I don't think so. I've been in the back of one when they came to school, like did a visit about first aid when I was like in primary school or elementary school for Americans. But yeah, I don't think, I know you have. Only 6 months ago. We put you in the back of one.
Yeah, that was the second time I've ever been on one. Well, it's fun.
Hopefully it stays at 2.
Yeah.
Can only hope. All right, so question number 2. In what year were ambulances first used?
As in sort of looking like the ones that we have nowadays?
No, an ambulance. Obviously, they're going to be more primitive, basic. They're not going to be, a car with an engine.
Yeah, but that's what I was referring to.
Yeah, no. But I'm going to give you five dates.
Okay.
A, 1671. B, 1412. C is 300 BC. D is 800 BC, so, before Christ. Yeah. Or E, 1487.
What was the other 14 one?
1412 or 1487?
1412.
You were close, it's 1487.
It is 87. Fuck.
They were first used by Spanish soldiers in 1487 during the siege of Malaga.
Yeah.
The Catholic monarchs of Spain conquered the city of Malaga from the Emirate of Granada. So at the time, the Spanish were like retaking their country, basically. The siege lasted for 4 months, and most of the surviving population were enslaved or put to death by the conquerors once they got their city back.
Aren't the Spanish people just the loveliest people ever? So, especially for me being from South America, and we have our history with our Spanish people.
Yeah, it's like, hey bro, we want our city back, but fuck all the people.
Yeah.
You're my slave now, bitch.
Let's rape and kill. Why the fuck not? Yay.
Yep. So, yeah, first use of... So ambulances have been around for about 533 years.
But what was that, a horse and a wagon?
I would assume so, I don't know. Or it's probably just a man with a cart, to be honest. And just chucking people on the back of a wooden cart. Now I actually have to skip ahead in my notes because I found something else to add to this. Combat ambulances. So there's a very clear distinction here. These ambulances from the Spanish were the first ambulances, but they didn't go in during combat. They waited for the combat to stop, and then they would go in and grab wounded people. And obviously by then, a lot of people were dead.
Yeah.
Combat ambulances, so when they would actually actively go in while there was still fighting going on, was actually first sort of thought of and come up with by Dominique Jean Larrey, who pioneered the use of ambulances during combat in the Napoleonic Wars in the early 1800s. So yeah, before this they would go in after the combat, but this guy, he made sort of the first like crews of medics that would actually go in and run in the middle of combat and grab their injured soldiers and then take them for treatment.
Yeah, so they would actually have a chance of survival, because obviously like some of the wounds during these battles they could be safe, but obviously since they were prolonged hours, they were just lying there bleeding.
Yeah,
they would
exactly.
Die. So
and getting all sorts of diseases, and they were malnourished. So you can think of these ones by Dominic Jean Larry as like the first modern ambulance. So, today you get shot, you expect an ambulance to come within a couple of minutes, not, sort of stuff like that. So, yeah. Sutures, something you should know pretty well. Sutures.
Sutures. Yeah.
Stitches, basically. Something you had only the other week when you got some moles cut off your neck.
Yeah, it's healing nicely though. Like I got a mole removed in the middle, like in the front of my neck, like just.
Yeah, you can't really even tell it's there actually.
Yeah.
Huh. Yeah, not really. They did a good job. But yeah, as you can imagine, of course, human beings have used sutures for a very long time, for thousands of years. But do you have a guess? When do you think the earliest reports of like sutures being used are like kind of confirmed?
Okay.
Was it in the year 3000 BC? 5000 BC? 1300 BC? Or 2000 BC?
It's either, I would say either 3000?
3000, yeah.
Or 2000.
Pick.
Let's go with 3.
Correct.
Huh?
In ancient Egypt, the first sort of actual documented historically cases of medical sutures being used on people.
Is it sutures or sutures?
I say sutures. It's probably sutures, whatever. Stitches. There you go. Bitches get stitches. All right.
Alex.
Now, how old do you think the oldest known suture is? Like, what year have they found proof? Actual proof.
Didn't I already answer that question?
No. But of a specimen. Not just a report,
specimen.
but on an actual specimen, on an actual person. Was it 200 AD, 3000 BC, 1100 BC, or 2000 BC?
100.
1100?
1100.
Oh, damn. 2 in a row. Yes. They found a mummy from the year 1100 BC that they found evidence of actually having sutured
Where was
wounds.
the mummy from? Egypt?
I think it was from Egypt, yeah.
Oh, because there's a lot of people that would have mummies.
Yeah, but I'm pretty sure it was Egyptian.
Yeah. Does it, like in the first questions, obviously because the Egyptians were the first recorded to actually use sutures in medical.
Yeah.
But does it say what type of material they would use?
Yep, I'm getting there now.
Okay.
Sorry if my voice sounds a bit rough. I don't know. Feeling a bit dry in my throat. But yes. You asked what materials are they made out of? Over human history, they've been made from materials such the needles. You need a needle to give someone a suture. So they've been made out of materials such as silver, copper, aluminium or aluminum if you say it wrong. Bronze and bone.
Yeah.
Of course, are sort of the main ones. But the sutures themselves have been made of materials ranging from flax or hemp and cotton, like natural materials, through to, of course, a lot of animal products like animal hair, tendons, arteries, strips of muscles from animals, even nerves, silk.
Silk is a common one.
Yeah,
right?
and catgut.
Catgut?
Yeah, it's a term for an animal intestine. It's like on the inside of the intestinal wall from animals.
Oh, the lining.
The lining, yeah. I think it's called catgut because I guess cats were easy to find. So it was probably the most common in like city streets. So that's what they were made out of. But the use of sutures and what's important in military applications is French military surgeon, I'm going to butcher his name, but Ambroise Paré, from who lived from 1510 to 1590, pioneered the use of them in the battlefield to treat amputees. So in the field, if they had to quickly lop off an arm, he made sure that they had trained medics that knew how to suture the arteries and the veins properly so that their soldiers didn't die.
But in a battlefield scene, like back in the day, wouldn't something like burning of the flesh be something that would bring a lot of infection, though? Yeah,
that was a big part of. I mean, there was a lot of infection anyway, but yes. And of course, so this sort of started that whole thing. Again, it's important because it progressed to the point where regular medics were starting to be trained how to suture. And obviously now these days, you have, it's not just surgeons that know how to do that. Your regular clinical like your general practitioner doctor knows how. Yeah. Vets do it. Even just someone who goes to a first aid course can learn how to do it. And this was sort of the beginning of that. Before that, it was really only surgeons that used sutures. But he trained their medics to do it.
The medical staff.
Exactly. And that's obviously then that progressed to. Then they went back to their regular lives and they're like, well, I know how to suture and I'm a vet or a regular doctor. I'm not a surgeon, but I can do this and that.
Well, they alleviate the pressure of just relying on surgeons to be able to perform that because
exactly.
There's only so many surgeons out there. Yeah,
and especially on something as serious as an amputation. Pretty important to make sure the poor bastard doesn't bleed out any more than he already is.
Yeah, you would hope so, at least.
Yep. To the next one. Anesthesia. It's anesthetic. Of course, throughout history, humans have, various herbal remedies and stuff like that.
Yeah.
But Russian Nikolai Ivanovich Pirogov was one of the first surgeons to use ether as an anesthetic in 1847 during the Crimean War.
Mm-hmm.
He was the first to ever use it in field operations, so out in the medical field. On the battlefield. During the Crimean War, which was when Russia was at war with an alliance of the Ottoman Empire, the UK, Sardinia, which is now part of Italy, and France.
Yeah.
And they were basically battling because the French backed the rights of the Roman Catholics while the Russians backed the East Orthodox Church in the Holy Land, which at the time was the weakened Ottoman Empire was in control of, but Russia was trying to move in and the Allies didn't want them, so they went to war. Yeah, this is important because ether was actually used as a general anesthetic for a very long time after this. Until non-flammable drugs were developed that did the same thing, because ether is highly flammable, which was one of the risks of using it.
Yeah.
But he was, so it's also used as a recreational drug even today. So basically he was doping these guys up real good, and he was the first in, he pioneered that, and then again it funneled down into general use.
Yeah.
He was the first to really just go, fuck it, we're using ether-based anesthesia. And
it's just so interesting to think of the experiments to get to that point to learn how to use different chemicals and
they need bodies, right? And they're well, we can either basically kill him because of the pain, or it'll take a lot longer to recover, or we can just knock him out, get the job done, less stress on the patient, he might heal quicker, and on we go. And so he pioneered the way for ether-based anesthesia. Antiseptic.
Wait, I want to go back to anesthesia though, quickly.
Okay.
Do you have any experience with anesthesia?
I've had laughing gas, I've had morphine. Morphine is a painkiller, but I've had surgeries, so I've had anesthesia.
But because people react differently, because usually when it comes to surgery, even now in the modern days, our everyday, people are really afraid of the anesthesia for some reason, even though the percentage of people that actually don't wake up is so low, but still it's a big fear. But people react differently. How do you react whenever you've been properly sedated?
I go sleep, I wake up.
Yeah. Well, I have a reaction whenever I get anesthesia, and I always have to tell, if I have a surgery, I have to warn the nurses on the floor.
Oh, you cry, don't you?
I cry
when
like
you wake
a
up.
motherfucker.
That's right.
Yeah. Like, so I always warn them, like, just so you know, I'll cry when I wake up. It has probably nothing to do with the pain. I'll tell you if I'm in pain. But for some reason, I bawl my eyes out whenever I wake up from an anesthesia. Like, the best was one when I had my shoulder surgery, because it was in a very small, specialized hospital for gymnastic injuries and stuff like that. And so there was one nurse, and she was circulating, because usually if you do it in a bigger hospital, you don't know who you're going to see afterwards.
Yeah.
But but she was so nice, and she held me as I cried, because I'd warned her before. I was like, "Are you going to be here when I wake up?" She's like, "Yes, I'm going to be here." I was like, "Okay, just so you know, it's going to be rivers. I'm going to cry like a motherfucker."
I think you called me, or she called me while you were crying to come get you, because that was only a day surgery.
Yeah,
I think I remember that.
no, that was when I had my knee surgery, when I asked them to call you.
Oh, yeah.
Because I could not stop crying for the life of me. But that was in a bigger hospital, and they were very rude. And even though I told them, it's like, I don't know why I'm crying, I can't stop. And they were like, really rude about it. And I was like, well, fuck you then.
Well, I mean, you are a bit of a weirdo.
Fuck off.
No, I think the weirdest thing I had when I was 12, I reckon, I got braces, but I needed braces only because, like, on my teeth, but I needed them only because two of my, I think they're called eye teeth to, like, regular people, like because they sort of start growing right up underneath your eyes, and then they move down the gum.
So they're
like the third ones out from the middle on the top jaw.
So your vampire teeth.
No, I've still got them. I think the ones next to that, one or two across from that, they're sort of like, whatever. It doesn't matter. They can't see where you're pointing.
Okay.
But yeah, anyway, so I had to go in for surgery because what happened is my original set of teeth, like my baby teeth, so to speak, my, OG teeth, milk teeth, whatever they're called, those two were the only two, for some reason, they didn't naturally come out themselves. Because what had actually happened is they had stayed put, and then the two that were the adult teeth started growing horizontally up.
Oh.
And I only found out because I went for a regular checkup, and they just did like an x-ray to make sure, nothing funky going on. And they're like, oh shit. So I had to have surgery to pull out the two like milk teeth, and then I think they couldn't save those ones because of how they were growing.
Yeah.
So I had to see like a special oral surgeon. And he was a wizard. He went up through the same hole at the root, the hole from the root where the original tooth was pulled out, went up, managed to turn both of those teeth around, and then take them back out through the same hole.
Jesus.
But I had laughing gas, like NO2, I think it is, NOS. And I remember halfway through the surgery, sort of just like, I didn't feel shit, but opening my eyes and just having literally his foot on my chest, and he had pliers and was pulling.
Yeah.
Like, and I could just feel like swaying a little bit.
Yeah.
With this grown man's foot on my chest. And that I think was weird. And then he was like, oh shit, all right. Just gassed me again, and I went back to sleep, and then I woke up with a whole bunch of gauze in my mouth and taste of blood, and it was not very nice. But,
yeah.
And then I had to have braces because then I had to pull, because then I was missing two teeth, so they had to pull all the other teeth in my top jaw like across.
So you're missing teeth, in other words.
Yeah, I'm missing two teeth. And what that actually did is I can feel the gap behind still where those two are missing, because on the front they look like they're joined together, but they're kind of on an angle. So at the back,
okay,
I can still feel that there's like something missing there.
Yeah, but you have very nice teeth.
Yeah, I had perfect teeth other than having to fucking rip out those and have a man step on my chest.
Yeah, well, comparably, like compared to the rest of my family, I have good teeth. But, yeah, that's not saying much. But I have one crooked teeth, but yeah.
And we should do one on dentists.
Yeah, the dentist.
They're fucking, don't poke your teeth with sharp objects, kids. And the first thing they do when you go in there, like scraping it and poking at it.
I hate the dentist.
Yeah. But okay, let's move on.
Yeah.
Antiseptic.
Antiseptic, yes.
So war has also paved the way for antiseptic ointments to be used on amputations during amputation cauterization.
Yeah.
So when they do finally go and burn off like any blood vessels and all of that,
The nerve endings and
nerve endings and stuff. Yep. Question: before this sort of invention of the antiseptic ointments, what was commonly used as an antiseptic agent? A. Boiling oil. B. An open flame. C. Acid. Or D. Alcohol.
I thought you were going to say bugs.
Bugs?
Yeah.
Like cockroaches?
No, because back in the days I know that like with dying...
like leeches and stuff?
Not leeches, like mealworms and stuff like that would eat off the dead flesh.
Yeah, no, it's not
okay,
that.
That's something else though. Oh fuck, I wanted to hear more about bugs. So oil, acid, boiling water, and alcohol?
Boiling oil.
Boiling oil?
An open flame, it's like open fire, acid or alcohol to cauterize. It's as an antiseptic during the cauterization process.
Let's go open flame.
Open flame, boiling oil.
Oh fuck!
They used to dip their arm or whatever in boiling oil and then like cauterize it. So yeah, we can thank warfare actually for bringing us antiseptic or like creams and ointments instead of dipping your appendage in oil. Like boiling oil. Yep. Boiling oil. Yep.
Oh, fuck me. Jesus Christ. See, for everyone that complains during this pandemic and shit like that, like, shut the fuck up.
Yeah, you got it good, man. What are you talking about? You don't have to dip your arm in oil that's after it's just been, like, severed.
Okay, that you can't compare the pandemic that we're going through with severed limbs, but still, like, there's...
Yeah, at least you have a chance.
Yeah.
All right, another one. Physiological monitoring. I'll explain. So the use of remote physiological monitoring devices on soldiers is now common. So these are the devices that like monitor their vital signs.
Okay, yeah.
So that when a medic or an evac crew is called, they can see like, what's their blood pressure? Is it dropping? What's the heart rate? What's their oxygen levels?
They put on your finger.
Yeah. And that's the thing. The investment in that tech that really kicked off like during the Cold War and stuff. Obviously now like we have it. Astronauts wear very complex systems now every time they go up on a manned spaceflight. So that someone back on Earth is basically monitoring everything, and before anything can happen to them, in theory, they could see it and predict it.
Yeah.
Of course, now we use it for things like treating dementia patients, monitoring brain functionality,
activity.
or if they have a fall, having things like that, sensors that can pick that up. Of course, people like diabetics.
Yeah.
People with heart problems, infertility can also be used for. Even fitness tracking, Fitbits, and shit on your phone or Apple Watches and all that crap. And of course, like sleep tracking.
Yeah.
This all stems from investment in military, basically.
Oh, that's so cool.
Because they wanted to, make sure that they could get their vital signs of their soldiers, and obviously, eventually, it becomes cheaper and more mainstream. But it's interesting you brought up Corona before, because with COVID-19 hitting as hard as it has in 2020, this sort of physiological monitoring has boomed this year and is expected to double in size over the next 5 years, because it's been seen as such an important thing now. Obviously, where everyone wants to be a remote. Like, instead of going to your doctor if you have a heart condition, imagine if they could just see your vital signs and you could just do a telecall.
Yeah.
Over Skype or WhatsApp or whatever you want to use, right? Or Zoom or whatever. So they're expecting the next 5 years that's going to boom, and it's because again, investment in the military. So it's not all bad; it's mostly bad, but now we get to the one that I think is like the most interesting. This is a bit longer. There's no questions left for you, by the way.
Okay. Did I win?
I think you got 3 out of 5. So pretty good.
Not too bad.
It's the first time someone's ever passed. Or maybe in the nuclear one Andy passed?
No, I passed. I won.
Oh, you won that way. And Andy still hasn't done his challenge.
Yeah,
so Andy, when you listen to this, I'm expecting them done.
Yeah.
You lost.
That was the first one we did.
Yeah, it was. That's true. But okay, I'm going to ask you a name. I know you're not going to know it, but maybe our listeners will know this name. Have you ever heard of a man called Sir Harold Gillies?
No. No.
Okay. I didn't expect you to. He was a New Zealand-born, London-based, bear with me, otolaryngologist.
Okay.
Otolaryngologist. Basically, he was an ENT doctor, ear, nose, throat
Yeah.
specialist. So he dealt with things to do with the head and the neck. He was a specialist with
So
that.
the doctor I went to the other week to get my mole removed on my neck.
Exactly, yeah. But this guy's probably much smarter than that guy, to be fair.
Hey, don't talk shit about
Well, actually,
Knut.
this guy
Knut
probably...
is nice.
This guy taught Knut what he knows, to be... Probably is what happened. He is widely considered, this Harold Delf Gillies, to be the father of modern plastic surgery.
Oh.
So, after the outbreak of World War I, he joined the Royal Army Medical Corps, which was initially posted... He was initially posted in Wimereux in Boulogne in northern France.
Mm-hmm.
So up in the trenches, basically, where shit was really going down. He was a medical minder. So basically, he supervised a French-American dentist
Okay.
called Valadier. Valadier was not allowed to operate like unsupervised, but he was allowed. But what he was attempting to do was develop like jaw repair things, because soldiers getting hit with shrapnel, getting shot in the face. So he oversaw this Valadier and made sure his practices were up to snuff. Because at this point he was already a trained doctor. He was a surgeon.
Face surgeons in general is like some of the absolute coolest thing, and obviously like during war back in the day, face injuries were some of the worst. But the thing is, like, yeah, if you lose a limb, if you get shot in the leg or have a massive scar, like that won't impact the rest of your life. But obviously you have to think, like, it's so important. Like back then, it was so important to develop that sort of medical advancement with face surgeries, because most of the people that went out in war were quite young and they have to live the rest of their life.
And they were poor.
Yeah, with a deformed face. Like, especially, I know we're not talking about World War II, but during that with all the gas, like...
World War One had a lot of mustard gas as well.
That was World War One.
That was World War One.
Yeah,
then
the mustard gas, Jesus. Like, if you see some pictures of the soldiers and the deformities they had on their face especially, it's horrifying.
It's interesting you say that. I'm going to bring up a point after I get through this notes. That's kind of on that, actually.
Okay.
So he was a medical minder. This guy, Valadier, was working on developing jaw repair surgery. Gillies saw him experimenting with skin grafting, which is when you take skin from one part of the body to fix a wound. After this, Gillies moved to Paris, still during the war, where he met the renowned oral surgeon Hippolyte Moriston. Weird name, probably butchered it, but that's how I say it, right? What inspired Gillies from this man, from Moriston, was he watched him remove a tumor from a patient's face and cover it with skin taken from the patient, so another skin graft, but like repairing the face in such a way that it didn't look that bad. Like, I think it was quite a big tumor. So this kind of inspired him to pursue this what's now plastic surgery. Yeah. So still during the war, but eventually after sort of working with these guys for a bit, he returned back to England. And persuaded the army's medical chief that they should set up a special facial injury ward at the Cambridge Military Hospital in Aldershot, because obviously there were so many soldiers getting shrapnel to the face, gunshot wounds, and back then this could mean, for example, like you may not be able to close your jaw ever again, and things like that, like if it was not repaired properly. Yeah. And it usually wasn't up until this point in time. So they set up this hospital, he convinced them, but it quickly proved pretty inadequate because, it was known as the Great War at the time. Yeah. There had too many soldiers, not enough staff. So they built a whole new hospital at a place called Sidcup in southeast London, which is now the Queen Mary Hospital, I think it's now called these days.
Okay.
So at the time it was called the Queen's Hospital. It opened in 1917 and had 1,000 beds. It was here that Gillies and his colleagues developed a lot of plastic surgery techniques during 11,000 operations on 5,000 men who were mostly soldiers with gunshot wounds or shrapnel.
Yeah.
From grenades or explosions shooting metal into their face. For his service, Gillies was eventually knighted in 1930, so that's why he's Sir
Gillies.
Sir, whatever his name was. Can't remember his first name.
The Gilly guy. I don't know.
Sir Harold Gillies.
I don't know. When you say Gilly, I just think of, is it the Gilly weed?
He's Gillies.
Gillies, okay, but I don't know. When you said it, the only thing that came into my mind was Harry Potter. When it's in the fourth movie.
Yeah, and they give him the
Gillies,
the weeds,
the weeds,
so he can breathe underwater. Yeah,
I don't know that.
But this, I think, is where the really cool stuff sort of starts with this guy that I think you'll find really interesting. Mm-hmm. So after World War One, he started a private practice and basically traveled the world teaching, lecturing, and promoting at the time what were the most advanced plastic surgery techniques.
Okay.
So if you actually if you look at it these days, if you look at some of the pictures of his work, they're very barbaric looking.
Yeah.
But compared to what came before, he was a revolutionary.
Yeah. But that's just how it is in history. Just nothing back then looked good, but compared to what they used to.
Yeah, but this is so World War One ended in 1918, right? This hospital was only set up in 1917. So even if you add a couple years after the war, maybe he saw some soldiers. But this was only possible because basically he and his colleagues, Gillies and his colleagues, had 5,000 people to experiment on.
Yeah.
In 11,000 different surgeries. So if it wasn't for World War One, he probably wouldn't have got anywhere near this quickly advanced in skin grafting techniques and ways of shaping how he was doing the skin grafting, which I'm going to talk about a story in a little bit about that was super interesting. But just to move on, so this is where I think you'll find really interesting. He was also a surgical advisor during World War II, but he didn't participate directly. But then he is also a pioneer of sexual reassignment surgeries.
Ah.
In 1946, Gillies and a colleague carried out one of the very first sex reassignment surgeries on Michael Dillon, which was a female-to-male surgery.
Oh, cool.
So not only did he do facial, then he moved into other parts of the body. And obviously I think these days it's a very topical thing.
Yeah.
It's becoming much more commonly accepted, and again, he paved the way. And also in 1951, he carried out one of the first modern sexual reassignments on Roberta Cowell, which was a male-to-female reassignment. And that he created the flap technique, which basically became a standard for the next 40 years after that.
Yeah.
That's
cool.
Gender reassignment surgeries. So he was a pioneer of many things in the plastic surgery sort of sphere.
Yeah, well, plastic surgery is so much bigger, because nowadays when we think of plastic surgery, it's usually, you think of a boob job, of some liposuction, butt lifts,
Botox. Is that even surgery really these days?
Not really. You can do that at your...
It's just a soccer mum thing.
Yeah, you can do it at your local...
beauty salon.
Yeah, pretty much.
Get the duck face on.
It's getting there.
Yeah,
it's fucking scary.
Get on the duck face.
Yeah, so I would say to our listeners out there, there's nothing wrong with getting plastic surgery done, fillers and whatever, but make sure that you do it at a proper physician, that you research what you're putting into your body.
Yeah, don't buy the cheapest Chinese... filler and then put it in your face, and then 2 years later it goes bad and looks like if you watch, what is it, Embarrassing Bodies, the UK show, and they always have people that put filler in their face, cheap filler.
Yeah, because it eats away at the muscle and structure, and they get deformed and stuff.
Or the filler itself just breaks down and goes hard like cement, like rocks, and they get all weird bumps and lumps.
Yeah, talking about cement, do you remember that story that I told you about that woman in the US that was literally putting cement in women's butts?
Oh my god.
Yeah, that was a fucked up. But anyway, so that is what we usually think when we think plastic surgery, the beauty enhancement, because that's the world that we live in now. Everything has to be Instagram ready and shit like that. But the plastic surgery field is so much bigger and so advanced. It's really big within the burn units.
Yep, I'm going to bring up a point on that shortly.
Within babies with, I think we quickly mentioned this in another podcast, the, what are they called?
Oh, the cleft lip.
Yeah, cleft lip.
Yep.
The advancement in that sort of surgeries too. It's amazing the works plastic surgeons make Actually, they should
I
get
think it was
more
the AI in medicine.
Yeah.
Where it's how they're using AI now to predict
how
how they'll look, so they do the best like methods.
Yeah, that's when we brought it up.
Yep.
Yeah. So I don't know, because people always, I don't know. I've heard people that go to study as medical, like to become doctors and stuff, and when they go into plastic surgery, well, here in Sweden, it's usually dentists. They give them shit because they're just money grabbers, which they are. But
Hey,
plastic
whatever.
surgery is fucking cool.
Yeah, especially like, and so I said I was going to give an example on the burn. So what this Gillies guy did.
Oh yeah, he's the one that's done. Yeah. No, I've seen his work before.
Yeah. Okay. Well, I just brought up some pictures because I was trying to find something. But anyway, I can't find it. I think the story goes anyway that there was a soldier who got so badly burnt. Pretty sure it was by mustard gas. That literally his face had basically melted off. He couldn't close his eyes or his mouth. And Harold Gillies literally basically completely, not fit. I mean, he still obviously looked abnormal, shall we say, but at least gave him some
resemblance of a
some semblance of a normal face. And like, the guy could close his eyelids.
Yeah.
And, so he didn't have to have droplets put in his eyes every hour or whatever to stop his eye, because it was incredibly painful, obviously.
Yeah.
He pioneered. What they did is they took, when they graft skin, right? So, they cut a patch from somewhere, or say if you got a cut on your cheek, they'll basically stretch skin from higher up or lower down, and then
stitch
to
it.
cover the wound and stitch it in such a way that they try to do it usually with skin around the area, because that way it keeps the blood flow.
Yeah.
Rather than completely like cutting off tissue and hoping the body accepts it back.
Yeah.
So what he did is he cut all the way from the chest, a flap, and stretched it up onto the guy's face. And then, but what he did is he observed that the edges of the skin would roll into a tube, like naturally. So what he did is he stitched it, but he left the tube sticking out, like of the skin, so to speak, and then did like a stitch a bit lower. So he almost had like the skin folded over.
Mm-hmm.
And then what he noticed is the blood wouldn't go all the way to the end where the tube is, but the blood would go to the bit where he stitched on the little, where it starts sort of curling over. So then he had way like better rejection rates, like, the body would take it on easier, much better blood flow to the area.
Yeah.
And then all he'd go later, once it had sort of started healing and the skin had, the body had clearly accepted it, and it reduced the chance of infection as well, because he's using sort of skin from the same area. And then all he'd go afterwards and cut off that tube, the flap, the rolled bit of skin, and just cut that off. So yeah, you'd have a scar, but it would actually cover. He took from the guy's chest,
but just pulled it up.
Basically, yeah.
But what would happen in between?
I think he did, like on the neck and stuff. He sort of stretched everything up.
Oh yeah, but he was all burnt. That's right.
Yeah, so he stretched basically everything up. Obviously, in certain ways and stuff. And he developed that technique with a sort of flaps, so it looks like there's a bit of a tube of skin that in the end gets cut off because that's going to die.
Yeah.
But then he stitched the skin, the good skin, so to speak, underneath, so the blood would keep flowing. And then that became like another revolutionary technique. And of course, the guy didn't look perfectly, not like he got back perfectly regular, but at least he could close his eyes and eat and close his mouth and
had a sort of a normal life.
So this Harold Gillies guy basically gave this guy back his life.
That's amazing.
And to thousands of people. So that's why I thought he was really interesting. And again, it basically happened because in World War One, he got a whole bunch of people that he could try these techniques on.
Yeah.
And pioneer.
Yeah, the advancement of skin grafting is really cool. Like, they were doing some research, I think it was in Brazil, to use, so instead of using your own skin, because usually ultimately they want to use your own skin. So let's say if you get burned on your arm, they would place something under to obviously expand the skin before to not to put so much stress on the skin.
Yeah.
They would put something underneath to inflate the skin so it grows naturally expands naturally, and then obviously then remove the extra skin, and that's what they put over. But they're doing, I think this was a while ago, I haven't looked into it a lot, using scales from fish. Yeah.
That's pretty cool.
Yeah. No, and that is working. Like the body is actually receiving it good.
Shit.
So yeah, it looks a bit weird. Obviously, you look like
A fish person.
yeah, but still,
Mon Calamari from Star Wars.
yeah. But it actually heals really well. Like the skin, your body accepts it so much better compared to other.
Yeah, well, that's often the problem.
Yeah.
Or like, especially if they take from another part of your body.
Yeah.
Like, let's say, okay, you're burn on your arm, so they take a patch off your thigh, let's say. Obviously, that part of taking it off and then transplanting it onto you can kill the tissue, or your body can reject it and be like, no.
But also, like, what I was explaining earlier with the expansion of the skin and stuff, like, that can take time, obviously, to do it as gently as possible for the body. Yeah. If you want, like, something looking very good, like, it takes time.
Yeah.
But with this type of advancement is for people that have, like, extremely serious burns to try to repair as quick as possible, because obviously the quicker you try to repair it, the more function, like, it... Yeah. So it's really cool. I'm going to look into that again. It was a while ago I saw that research, and it's actually really cool.
It's really cool. But yeah, I mean, that's all I had on this, so I hope it was interesting.
I thought it was really... I like medical stuff.
Yeah, but I thought you wouldn't like it because it had to do with the war, and you're like, I don't know anything about war.
I know shit about war. What are you talking about? Yeah, I don't know anything about, like, artillery, weapons, and stuff like that. That I'm a bit clueless. I know some shit, but when it comes to medical advancement and, like, warfare in general, I do think it's actually really interesting. I do look at a lot of documentaries, read research and stuff like that.
Yeah, it is. I actually think the one that shocked me the most was the ambulances. Yeah. Like, only being, 600 years old, not even. 630, 530. I was like, surely you would have had them well before, but apparently not.
Oh, you mean the feel, like the...
Yeah, like just like having an ambulance. Yeah. Like a dedicated vehicle and people to go and take wounded soldiers or wounded people. Yeah. Because obviously, like, my life, my parents' life, my grandparents' life, my great-grandparents probably, an ambulance was normal. Yeah.
But usually back in the day, that would cost time. So, like, what you would do, you would have doctors that would come to places. Yeah, people would die more at home. Yeah. Yeah, true. People back in days would die home a lot more often. And, yeah.
But I think that was probably the one, at least to me, that shocked me. Not shocked me, it was just like, oh, shit. Like, I thought it would be much older, but it wasn't.
Surprising.
Yeah, surprising. Exactly. But yeah, I guess that's it. You got anything you want to add on this episode, or should we wrap it up?
Medicine is cool. Let's put it there.
It is. Well, thank God for it, or we'd probably wouldn't be here because one of our forefathers would have died before having the chance to procreate.
Yeah, and obviously I'm very grateful to be well, you've heard that I'm not the healthiest person. I'm not a sickling, but I have a tendency.
You're clumsy. Yeah. You're like Jar Jar Binks.
Yeah. My body was not designed for this world, let's put it like that. I'm actually a mermaid.
You weren't designed for gravity. Like, if you lived in anti-gravity, you'd probably be all right.
I should be a space monkey. Yeah, let's put it like that. So so I'm very grateful to the advanced medicine we have nowadays, and obviously these guys that we've been talking about and throughout the history has led us to this point, which is really cool to hear about.
Yeah, I mean, it's bad that it got there through warfare in a lot of ways, but obviously that's kind of like in the case of Harold Gillies, like that's how you just get the pure bodies to do these experiments. And in kind of, I guess in his case, like they were kind of already fucked. So he couldn't make it any worse. Yeah. So just like, all right, well, guess we will try some shit. But yeah, it's been a nice episode without Andy. No interruptions. Yeah. Flowed pretty smooth. So if you listen to this, Andy,
fuck you.
Nah, I hope you're doing good. I want to hear your poop story next week. Yeah. I'm sure there'll be a new one if you're back.
Let's hope so. We hope that Andy will be back next week, because he does bring a lot of life to this podcast.
He brings his weird Belgium charm.
Yeah. And a lot of smoking and coughing.
He does do that a lot.
You don't hear that, but we hear it.
All right, let's just not shit on Andy. Hope you're doing good, buddy. And we'll talk to you next week, I hope. But what's our Instagram? Where can people find us?
Yeah. Also, today we're recording a bit earlier than we usually do because it's just the two of us. And Alex wants to play Cyberpunk after this.
Fuck yeah.
But in the description below, we usually record on Sundays, so you can come and join us live. So don't forget to click that and join our Discord group where you can talk to us directly and also see us record live if you want to take part of that experience. And our Instagram is @random.podcast, so at.random.podcast.
And on Twitter, we are @AT_randompod. So give us a follow and retweet everything. Spread the word. Hit us up if you want if you have an episode suggestion as well. We did one, I think 2 weeks ago now, that was recommended or asked for by one of our listeners.
Wasn't that last week?
Was it last week?
Yeah.
Maybe it was last week. Whatever.
Time in this year. They
it was
together.
last week. Yeah. So if you have episode suggestions, I mean, we're always looking. Sometimes some weeks we struggle, some weeks it's easy. So it's always nice if you have something you want to hear, let us know, and we'll do our best to fulfill it. And without much more to say, I guess I'm Alex. That's Ali.
Yes. And thank you for listening.
Yeah.
Come
Bye.
join us next week. Bye.